All right, so you ready to record? Okay. All right, welcome back to Change of Pace Chiropractic. This is Dr. Jamal Pace, again with another patient on the table. Now, this is a special patient, all right? My guy's an athlete, okay? So he has a history, all right? He's an ex NFL player. It's Tutan Reyes, okay? You might know him from what teams, man? Go ahead and tell him. The Bengals, the Panthers. So he had a long career, right? It definitely is not just the NFL. He's been playing college. He's probably been playing Pop Warner. So every time, again in football, every time that there's a tackle, right? So you got to kind of look at it as like a mini car crash, okay? And so this is what he's been putting his body through for several years, all right? So I see patients that have car crashes. I see the type of injuries that they come in, and that's just one, all right? So every time you're tackling, especially the higher up or the levels you go, the more impact, the more speed, the more force that this body is going to take. And so it has changed his body a little bit, right? So a lot of times, a lot of these players, they, deal with these injuries after they leave the league. They leave that career behind, and they are left with basically the result. So primarily what we're looking at for him is his lower back, and this is very common, I'm pretty sure, for a lot of football players, especially the ones that are getting off the line and get from a lower position and have to go up, right? Because you leverage a lot of your lower back, and so that puts a lot of compression into that lower back, the disc, the joints, and so likelihood of wearing that down and breaking that down is higher, okay? So mainly he's already had previous treatment. He had MRIs. We already know that he's dealing with a herniated disc, L5. And so we did an exam, and basically we kind of can tell that he's having some nerve impingements, right? Some shooting pains down into his legs. He's not able to kind of stand or sit or get up from seated positions without, kind of compensating and changing his body from the normal movement. So this is what basically chiropractic is going to be trying to do for him, is to restore as much mobility back to his joints as we can. Again, we're trying to find all the joint restrictions. That motion, that mobility is so important for the health of his muscles, his joints, and primarily his disc, because they allow movement in all directions. So we want to keep that healthy. We want to keep that fully functioning. And if it stops functioning correctly, then a lot of that stiffness, tightness, and pain is going to amplify. So right now he's dealing with a little elevated levels of pain. He knows it's time. He's had previous treatment, chiropractors, but he hasn't been here yet. So we're going to introduce him to, our style of adjusting. Okay. All right, man. So we were just having a conversation about how long he's been dealing with pain. So he's been dealing with pain since, what'd you say, '04, man? '04, '05? So he's had this lower back pain for a long time, and a lot of people do deal with pain for an extended amount of time, and they kind of sit on it, they kind of manage it a little bit. They think it's going to go away. Magically, is this going to go away? But again, I'm going to keep giving this tip out. If it is going past 3 months, 4 months, then there is something more serious going on. And what I kind of told him is it has to be some kind of structural change or a structural injury when it's basically leading into chronic pain and chronic tightness. All right, so please do not wait to get treatment, man. The sooner that we can kind of address it, the higher our probability of being successful for kind of controlling and managing the pain that you're in. Because again, it just progressively gets worse as you get older. All right, so there's a natural wear and tear. I don't care who you are. As you get older, that's just the circle of life. There's going to be a natural wear and tear on our bodies. Okay, so we're going to try to do as much as we can to try to alleviate some of his symptoms with this adjustment. All right, so let's go ahead and get started, man. Okay, so what we kind of found in the other office is we have a little imbalance. He's kind of favoring his right side. His left side is actually the primary source of his pain, just from the orthopedic test. And again, looking at his leg length, we got one longer leg on the right, one shorter leg on the left. So that means he's been carrying a little bit more weight over here on the right as a compensation. He doesn't want to overload the left because that may cause a little bit more of a flare up there. So we're going to be working on balancing this out for him. Obviously trying to do as much as far as the adjustment is concerned, unlocking the joints to alleviate the pressure on his disc. Okay. All right, so we're going to start off with a little slight stretch here for you too. Okay. I'm going to be applying pressure to the top of your hips here. If I'm increasing pain, please let me know, man. This is not the point of this, all right? So I can kind of scale back what I'm doing. Now, as I'm stretching, give me a big breath in here. Go ahead and breathe all the way out. Exhale. Very good. Good stuff. Good stuff. All right, give me another big breath in here. Exhale. Good. Here's another tip, man. If you think that surgery is going to solve everything, surgery doesn't necessarily solve every issue. All right, there's still a probability of still dealing with pain. Sometimes it can increase the pain. There's usually an expensive treatment, right? Invasive, so you have to run the risk of infections. You have downtime, you have to recover, right? There's usually PT involved. And so again, a 50% chance with back surgery of actually being successful. So I hope people are not spending all of this money on some treatment that's not going to necessarily help them, but actually can make it worse. All right, so that's another thing we want to prevent, is that path is going down that surgical route, because that again is going to create a permanent change, and you're still going to be dealing with that lower back issue. All right, man, I'm gonna kind of stretch your shoulders here, okay? Just kind of let your left shoulder just relax for me here. Let me know about any pain here. Let's go here, this side. All right, thank you. All right, let's get started, man. We're gonna start off with your rib cage, man. So these are your accessory joints, basically the bones that come in and attach to the spine, okay? So what I'm gonna do to adjust the ribs, I'm gonna be leveraging and lifting the front of your hip up, just so you know what I'm doing, all right? I want you to relax your legs, relax your hip. I'm gonna do the work for you. As I'm doing that, you're gonna feel impulses as I move up into that right shoulder, okay? So on this one, you don't typically hear loud cavitations, all right? You may feel this kind of unlocked though, again, because of the rib heads, they do come in attached to the spine. But this does start to cause tension to be held here in the mid-back. And again, it can affect your breathing as well, right? So when your lungs are expanding, when you're breathing and contracting, your rib cage moves up and down. So if it's restricted, then it can affect that too, okay? All right, so I'm gonna be lifting here. Let me get that pillow down, out of the way, sorry. Good. All right. All right, you're gonna feel a quick impulse here first. Good, moving up. Are you okay with that pressure? Good, moving up here. Good. Good, moving on up. Good. Good. Got 12 ribs. There we go. I'm gonna do the same action over here on the left for you. Lifting in the front. Good. Moving on up to that shoulder. So far, so good. Good. Not bad. One more. Good. Thank you. All right, now let's go ahead and address your leg length here. All right, so again, we're going to be shifting your body weight from the right, kind of trying to get it back to the middle to equally distribute that weight, okay? So I'm going to be influencing this lower left, all right? This table's going to drop underneath you to assist in this. That's primarily all you're going to hear on this one too, all right? Just a quick impulse right where my thumb is. All right, I want you to take a big breath in from here. Exhale. Here's our first one. Let's make sure that doesn't irritate your lower back. You okay? All right, very good. All right, going right back to that joint here. Quick impulse. Good. You all right? All right, one more. Get a little rotation. Okay, let's bend your knees here. We had a little aggravation over there on that left side. We're able to push this further. We get some resistance about right there. Cross this over in the middle for me. Let that fall. All right, now our target is here. Keep that foot crossed. You're gonna feel two impulses here. Here's our first one. So what we're doing is addressing your tailbone. This moves, it wags between left and right when you're walking and running. It can favor one side and it can start to cause that resistance in your leg movement there. Let's bend here. Good. So we start to kind of see equal leg movements. That's going to be important. Okay. Drop this down. How we doing? We all right? Okay. All right, man. To the spine we go. So this is where you can hear some cavitations, man. You can hear some noise a little bit. Let's see what we got. It's been a little minute. I want you to drop your arms outside the armrest for me. Just let them hang down. I know your forearms about to touch the floor, but it's all right. I won't step on you today. All right. All right. Just let it relax. Okay. What you're gonna feel, I'm gonna bring your head to my hand over here on this lower right side. There you go. All right, so you're gonna feel a quick impulse into the side of your neck here. You may feel things open up for you as well.
Oh.
Uh-huh. That's that first one, brother. We just getting started. But no, in all seriousness though, how did it feel, man? Okay? Good. All right, so a lot of compression right there. The joints got stuck. All right, so I'm gonna be stretching that muscle out. This is like a little muscle floss, man. So that helps break down like fibrous tissue that can develop from constant tension in these muscles. Bring your head back to the middle for me. Help me out there. Good. Continue to relax when we go to a different part of that muscle. So it kind of points out trigger points as well. Try to break them down for you too. Bring your head back to the middle. We're gonna do another part of that muscle. This is the last one. Good. All right, bring your head back to the middle. Okay, so this side is up next. All right, I'm gonna be pushing your head over to that left side. Now you kind of know what to expect. I still want you to let that left shoulder relax for me, kind of let it go limp. And again, you're gonna feel a fast impulse here, man. There you go, very good. Bring your head back to the middle when you're ready. There it is. Yeah, you probably didn't think it was more left up in there after that first one. All right, good. Bring your head back to that middle point. Nice big stretch here. That's perfect. Bring your head back to that middle point, and then we're going to stretch here. Thank you, man. Appreciate it. Bring your head back to the middle. Okay. Now the mid back is next here. Okay. Right in between those shoulder blades. Again, I'm gonna ask you to keep your arms down for me. All right. Now you're gonna feel a very fast impulse on the side of your spine here. Okay. I want you to take a breath in again for me. Okay. Now your concentration is blowing all that air out of your lungs for me. All that air. You're gonna feel a quick impulse. Good. Nice opening there. You all right, man? Okay. Thank you. Let's move down a little bit. Big breath in. Go ahead and exhale all the way out. Let this go. Good. All right, a little tough there. We're gonna get a board for that one, okay? I'm gonna explain that to you in a minute. All right, now let's get to the lower back. So what I want you to do, we're gonna bring this side up, man. I know this is a little bit more sensitive than the right, so let's go ahead and get this out the way, okay? Lay on top of this hip and shoulder for me, man. You're gonna face me to your left. All right, that's perfect. Okay, so what I'm gonna do, I'm gonna give you a little support for your head here. Just let your head fall at the top there. Good. All right, I'm gonna take a little bit of pressure off that bottom shoulder too. So hang on to this forearm for me here. That's perfect. We're gonna bend the top knee, and the bottom leg is gonna stay straight for you too, all right? Okay, now I got you. I know you're a big guy. You're not gonna roll off the table, I promise you, all right? I got you, okay? First part of this is just a stretch though, okay? Let me know about pain increasing if you are experiencing it. All right. Big breath in here. Breathe out as you're stretching. Good. Let's hold that for a second. We good here? Okay. I'm gonna let your muscles catch up. Okay. Now, I need you to keep these contact points for me, all right? All right, brother. So what you're gonna feel? Quick impulse into that lower back, okay? Let me see if I can get this to unlock for you too. Continue to let your legs relax. Okay, very good. You okay?
Yeah.
All right, come on over to the other side. Very good. Uh-oh, looks like I got me a new car. Here you go. Go to the other side. Here, I can put it up here, man. I don't want to step on your stuff. There you go. There you go. All right, you're welcome. All right, lay on that side. Okay, I'll pull you here. Same thing, same setup. Let that sit there. Get this one. Good. Get this one. Good. All right, here we go. Big breath in. Exhale. Stretch okay? I see your face. Okay. Give me another one of those breaths. Just gonna hold it for a second. Exhale. There you go. Just relaxing. There you go. Thank you. All right. All right. Keep your contact there, brother. Okay. Let's see if I can get in here. There we go. Thank you. Big release there. Look at that. He probably looked at me like, man, he ain't gonna be able to do that to me. Here, lay your back for me, bro.
Oh, man.
Lay your back. There you go. All right, man. So I told you to come back to that mid back, man. Here's that time, okay? So this is what we're gonna do. I don't want you to use your back. Use me to sit up. I know you got pride, but use me to sit up, brother. Use me. Don't use your back. Thank you. Thank you. Thank you. All right. So we're gonna use this board here. I'm targeting this area for you, right? Right where that QL was kind of coming in and attaching. Okay. So I want you to wrap your arms around one another. Yep. Put it right under there. Tuck your chin for me too. There you go. My hand's gonna be right there. All right, now relax your upper half here. All right, I got you, man. Okay.
Ooh.
I got you. I'm telling you, don't use your back. Don't use your back. Relax it. Relax it. I got you right there. Thank you. Keep your chin tucked for a second. You can let your head fall now. Let it fall. Thank you. Yep. 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 I told you. I told you.
Oh, man.
All right, man. All right, you can relax your arms there. You don't know what to do with your hands, Ricky Bobby. Just leave them right here on your stomach. Leave them right there on your stomach, okay? There you go. All right, I'm going to drop your head back here, boss, okay? Now, again, another thing with him is headaches. And so what he's telling me is he didn't get any frequent headaches, all right? But his frequency is about 2 times per week, okay? So if we add that up, it's 52 weeks in a year. That's about 104 headaches a year, okay? So what's normal is 5 to 8, all right? So we're gonna kind of see if it's tension coming from his neck muscles that are creating, headaches for him. It's cutting off blood circulation. It's preventing lymph node drainage, and typically headaches can arise from that. So that's why we kind of get the neck adjustment. That's why chiropractic is kind of, effective with, relieving and sometimes reducing the frequency of these headaches, is because it could be coming from the neck itself. All right. So what you're going to feel me doing is going to measure the occiput. This is the base of the skull here. This is very subtle directed. Okay. And so again, you can hear a little bit of noise on this one. It's not going to be sounding off like the rest of it, though. Okay. All right. All right, I'm going to turn your head over to that left side, too. There you go. A little bit of pressure here. Again, it's going to be very subtle for you, man. Just like that. You okay? All right, very good. And let's just make sure that this isn't stuck. Good, we're good there. Now, this next part is one of my favorite parts of the adjustments, okay? So it's called the Y-axis adjustment, okay? So this is in an effort to decompress your spine, all right? So take some pressure off of that L5, okay? So hopefully we can get all the way down to your lower back, but I'm gonna be at your neck, okay? So it's gonna be just an adjustment. It's gonna be a quick impulse, and you can feel it travel down, but it kind of gets deeper into that spine. And so a lot of times patients come in and in pain, and they're kind of looking for a specific relief. This is typically the one that produces that relief for you, okay? So hopefully we're able to get it to travel down, okay? All right, so to set you up here, I'm just gonna drop your head back a little bit. I'm gonna lift your head here. And I just want you to let your head fall back to that table like my hand isn't even there, okay? So just let your body continue to relax. You're doing an amazing job, actually, okay? Now my second hand is gonna go underneath your chin. I need to stabilize your head, okay? So just rest your teeth, don't clench them. That's gonna tighten up your neck, and that's gonna stop our travel, all right? And make sure you're breathing through your nose, please, okay? So here's a little preview too, so make sure we're not causing any pain, man, all right? This is what we're gonna be, kind of the direction we're heading. How did that feel, man? Does that feel like it's causing or increasing pain anywhere? Okay, good, okay. All right, just continue to relax. I'm not gonna tell you when though, okay? All right. Ooh. Yes, sir. Yes, sir. That's all I gotta say. Yes, sir. That thing felt like a juicy juice jar. No, for real. That was big, man. That was good, though. That was good.
I mean, I haven't been adjusting anyway.
Yeah, I know. How you feeling, though?
I'm good, but...
Did that feel okay?
Yo.
I know. Did that feel okay?
Yeah.
Okay. How far down did it go?
Probably mid-back.
Mid-back, okay. All right, man. I was trying to get down there. It's okay, though. It happens. It happens. Okay. All right, man. So we got to get the rest of your body on track. All right. So we got the spine. Now we're going to check out the ankles, knees, hips. Again, very important for the lower back issues. If this is tight, hamstrings are tight, you know it directly affects the lower back. Your hips directly affects your lower back. Even how you're walking, if you're having ankle injuries, you lean onto one side or the other, all that good stuff. So that's why I check the entire kinetic chain to affect that area that we want to get to, okay? So I'm going to be checking here first, a big stretch at that foot. You ever had your ankles and stuff adjusted too? None of this stuff? Okay. All right, let's see what he got. Good. Any injuries I need to know about in your legs? Okay, good. All right, let's see. Big stretch here. Good, that's what we're kind of looking for, okay? All right, now I'm gonna check your knees out here. So,
I told you,
bro. I told you, yo. I told you, man. All right, so we're gonna do a little bit of pressure behind your knee here. So this is the fibula head, lower part of your leg. It comes in and attaches right at the bottom of that knee. And so that can get stuck on you too, create knee issues, knee pain, tension, tightness. I'm gonna go ahead and adjust your hips here too, man, okay? Let this leg relax for me. I'm gonna stabilize that hip right there. You're gonna feel a nice big pull at that hip. It's gonna affect your lower back too, okay? All right, let this go for me. Good, good. That was tight too. That was stuck, okay? All right. You feeling all right? Yeah, I see your face. All right, let's get this knee over here. All right, that one was better. Let's go ahead and decompress that knee and that hip, okay? And again, that left side was a little sensitive there. And that was a big one, man. There you go. All right, we good? Okay. All right, your hands, man. Let me get your fingers. We're gonna work our way into your shoulder. Just relax them.
Of course.
All right. A little bit of pressure behind your elbow. Now, we are in the business of helping people, not hurting them. Okay? This one feels weird, though. It's going to be a quick stretch, though. It's not bad. Once you get it done, you're like, oh, that's it. Okay. All right. Here we go. A little pressure here. There you go. And both of them need to do. All right. Same thing. Here, just take your watch off for me on this one. I'm going to check your wrist out. Perfect. You rest it there. Another thing we're going to do for two is something called lumbar decompression. That table, you may have seen it on my page as well. Help kind of take pressure off of his disc, stretch his muscles and ligaments and tendons down there. Re-lengthening that spine. Also creating space for his nerves to travel a little bit more free. He also kept his wallet in his back pocket, so that's a contributing factor to sciatica. Okay. Like I told him in the office, if you keep your wallet in your back pocket, it's basically compressing and it's causing a nerve impingement because that sciatic nerve runs from the lower back into that back pocket. So if your wallet is there, it's going to impinge it, especially sitting on top of it. Then you got to think about it, sitting on top of it is going to create unleveling of your pelvis. And so that's going to create imbalances there. And your body's going to begin to kind of hold your lower back slanted. And so that's going to create other mechanical issues and pain, okay? All right, man, so we're done. Use me to sit up again.
Yes.
Good.
Yes, sir.
Good. I want you to swing your legs over that way. I'm going to check out your shoulders. What I need you to do for this part, rest your hands on your waist for me, okay? Good stuff. You're going to push this elbow back into me, elbow back. Okay, we're good there. And same thing, elbow back into me. All right, we're good there, okay? All right, go ahead, stand up, man. Walk around a little bit, see how you're feeling. That was smoother than you're coming out that front of the weighting area, yeah. Okay. All right, we're able to straighten out that leg a little bit. Okay, very good. You feeling okay? All right, again, it doesn't instantly heal everything. I know you still got some discomfort, okay? This is years and years, right? So as long as we get some kind of relief, that means we're on the right road. Okay, very good. All right, man, very good. Okay, I appreciate you so much. All right, we're gonna do that next therapy though, man. All right.